Welcome to Taking Care of Business on News Talk 1180 KERN for the best in Saturday Talk Radio at 1 o'clock and on 1230 KGEO at 10 o'clock Saturday. And for the best in Wednesday Talk Radio on 1410 KERI, the Christian station. We are now on 1000 KKIM in Albuquerque, New Mexico, and also on the internet on knookmedium.com, serving Richmond, Oakland, and the San Francisco Bay Area. Your host is Clay Koerner, and I'm Marty Pay, and our producer is the infamous Greg Held.
Infamous?
Infamous. I just thought I'd throw that in there, be a little different this year.
He's pretty infamous, all right.
Yes, he is. Hey, Clay, you missed a great show last week.
What do you mean? I heard it.
You did hear, but you weren't here.
Oh, but I did hear it, so I didn't miss it.
Well, you missed it as far as being in studio.
True. You missed all my wonderful questions.
Yes, all three of them. But we're going to have Jim Lacey back, the author of Taxifornia. That was really good. And we've just set up former Congressman John Lebeau is going to be back for about an hour.
He was
February.
good.
I like John a lot. I really, really like him, and he's willing to come back to talk to us again. But today we've got your kind of show, Clay. We're going to talk about Obamacare, your favorite subject.
Well, I have a new job, I work for President Obama now.
That's right. Well, according to what our first guest has said in a little publication, or a little sheet he has, we all work for the federal government.
Well, I do. I sell health insurance, so
That's
I work
right.
for President Obama.
Personally. I have a few things you can tell him for me.
Hey, he's my leader.
On that note, in the second half, we have a doctor who has sued the federal government, Dr. Larry Kawa. But in the first half, we have a local doctor who is actually one of my doctors, and he has something interesting that he gives his patients when they come in the office. And we're going to talk a little bit about Obamacare and a little blurb that he gives his patients. Dr. Robert Waguespack. Doctor, welcome to Taking Care of Business.
Thank you. Happy to be here.
So before we get into this, you're, as you put in this little page that you give people, you're really nonpartisan. You're not looking at this from the political aspect of it. You're just looking at this in terms of what it does to healthcare for your patients and for you as a practitioner.
Exactly. The doctor-patient relationship as we all expect.
Right. Okay. Or I've learned to expect over the years, and now has changed.
Correct.
Okay.
Correct.
Okay. Let's talk a little bit about who you are, first of all. You're a doctor here in Bakersfield. I
am. I'm a urologist. I moved to Bakersfield in 1999 and started my practice, a solo practice. Prior to that, I had been in the Army as a urologist. I had done my residency in the Army for about 10 years.
There's a little high five there between the two Army guys here. I guess the Marine is sitting here in a corner by himself.
Well, we have to have unity, you know.
Yeah,
that's right.
You do. Well, something about Clay, a urologist in the Army, that kind of.
Hey, he's not my doctor, Marty. He's not my doctor.
This is true.
He's your doctor.
Now, you worked with the Rangers, didn't you? Or
I was at Fort Bragg, and that's the home of the airborne.
Yes.
There were Rangers there. Primarily, I was in the hospital as a urologist. I was also on a forward surgical team. Fortunate enough not to have been deployed during that window of time when we weren't at war.
Sure.
But I got my training and then was able to get out.
Get out successfully.
Correct.
So tell us a little bit about this page that you are using to give to your clients.
It's a note called To My Patients.
To My Patients.
Yes. Well, it came about out of increasing frustration with regulatory intrusion into this doctor-patient relationship. The essence of that relationship, the essence of every visit is, I'm going to come into a doctor, I'm going to put my trust in them, I'm going to be open, and the heart of that visit is to improve my health, to address a health problem. Whether it was Obamacare or indeed the regulatory intervention that came preceding that, all of those things have done nothing to foster that relationship, have done nothing to improve one's health. They've simply intruded in that relationship. We see that in other industries, but this requires a very personal interaction between that patient and their physician. And it doesn't matter that it's urology that I do, which involves very intimate subjects at times. It could be with your primary physician or any interaction with a physician. And it's that intrusiveness that I think is eroding away that relationship.
Let me bring up some of the points that you talked about in your note. You said there's going to be a current doctor shortage. The law is going to bring major cost increases. We're going to see rising insurance premiums, higher taxes, a decline in new medical technique, a fall off of miracle drugs, less drugs being developed. These are just some of the things that you brought to the attention of the people. This must be frustrating to you as well as your patients.
Oh, without a doubt. And I think we see all of those things happening at a greater and greater degree.
Let me read that page for you, okay, and then we'll go over some of the things that you've mentioned in here. To my patients, Section 1311 of the new health care legislation gives the U.S. Secretary of Health and Human Services and her appointees the power to establish care guidelines that your doctor must abide by or face penalties and fines. In making doctors answerable to the federal bureaucracy, this bill effectively makes them government employees and means that you and your doctor are no longer in charge of your health care decisions. Let's stop there for a second. We'll take this a piece at a time. What do you mean by you being now a government employee, in effect?
If I take payment from the government, which is the essence of Medicare, Medi-Cal, and such, and indeed this new Obamacare, there are regulations which, as you know, determine what sort of insurance coverage one is required to have. Beyond that, it limits the parameters under which I can practice. Perhaps if I want to prescribe a medication, perhaps if I think you need an x-ray or test or even a surgery, I must go through an approval process. And some will say, well, that's the essence of HMO and today's medicine. Well, it is, except that this is now coming down as a federal mandate. So while I or you may choose not to participate in insurance plan X, when federal government insurance plan X exists, there are federal penalties that come with deviating from that practice.
And before you read on, but the other side of that coin is, if you don't do some of those treatments that they say you shouldn't do, you leave yourself open to get sued if that person later on develops additional sicknesses because you didn't do some tests.
Correct, which is, again, that isn't why we do what we do, but it puts us at risk. It puts our practice at risk when we say we should do this, we're not permitted to do that.
Our in-studio guest is Dr. Waguespack talking about Obamacare.
You know, you mentioned earlier that you're not going to accept Medi-Cal or Medicare. Medi-Cal is now Healthy Families as part of Medi-Cal, so they've increased the Medi-Cal enrollment tremendously, which means you're limiting the number of people you'll be able to see, or on the other side of the coin, people are being limited as to who they can see.
That's exactly true. And I think when we see the other contention, doctor shortages, it is not provider shortages. It's who can you see? And we've, in the past, always had, or mostly had, the ability to select who we want to see on the basis of our comfort level, on the basis of their competence. That's being limited. That's being limited by insurance companies. Shrinking provider networks. Who can you see with insurance plan X or Y is determined by that insurer.
I guess my next question, and maybe we take it up when we get back from the break, but is this are you not seeing the patients for financial reasons, or is it because of the government control and restrictions it places on you? Strictly
regulatory reasons. Heavens, when I see a patient who has Medicare or Medi-Cal or no insurance, what I charge them is what I would typically get from Medicare anyway. And you have to have a starting point. There are people who claim that the reason to get out of this is because of declining reimbursements. That's happening across the board. That's something that's been going on for years. So it's the regulations and it's the interference with that relationship.
And doesn't it take much longer for you to collect payment from Medicare?
That hasn't, to be frank, that hasn't been the issue. That hasn't been the issue. There are, they're reasonable in what they do. It is the requirements have gone further. We must have electronic records. We must submit bills in a particular way. We must meet certain, in quotes, quality criteria, which are simply giving your information to this third party, the government, to ensure that I did my job in my relationship with you to their satisfaction. That's not health care.
Goofy. When we come back, let's pick up with the rest of your letter. We'll be back in a moment on Taking Care of Business on Koerner Radio News Talk 1180.